Hi, and welcome to my channel, Diagnosis Dementia. My name is Gwen Griffin, and I'm a licensed speech-language pathologist who's been working with the adult and geriatric neurological population for many years. I hold a master's degree in speech pathology from Temple University, and I'm certified by the American Speech and Hearing Association. I also hold a patent pending in a revolutionary cognitive retraining program called What's Next. I'll tell you more about that when appropriate. But for now, I want to help you, the person newly or recently diagnosed with dementia or with MCI, mild cognitive impairment. I want to guide the caregiver in a better understanding of the issues and nature of cognitive deficits because there's so many misconceptions about it. And I want to help answer your specific questions via an interactive live video once a month. I hope you will participate with me. You never know who else you'll be helping with the questions you ask. Let me help you navigate the murky waters of cognitive impairment. I will never offer medical advice, but rather offer solutions to everyday problems you might be facing with a therapeutic approach. My goal is to demystify this terrible and often misunderstood diagnosis, and with your help, I think we can. Although I want to help you, there is no guarantee that I will. But if you come away from these videos with a sense that you are not alone, I have done my job. As Rumi once wrote, we are all just walking each other home. Hi, and welcome to Diagnosis Dementia. My name is Gwen Griffin. I'm a speech-language pathologist, and I've been working with the neurogenic elderly population for over 28 years. And what I noticed out in the field is that people have been getting diagnosed with dementia and they're left with really not very many resources. They don't understand what it means, where they're going. Families are very confused and people get scared. And I just wanted to share my experience with the audience so that maybe I can ease your mind and maybe I can answer some questions for you. So the first video, which this is, I thought maybe should focus on the diagnosis of dementia, what it means, and the types of dementia that you might have heard or have been diagnosed with. And so, but first I want to talk about the incidence and prevalence. There are approximately 6 million people, and by the way, I am using my notes because I want to get this right because we are talking a lot about detail today. There are approximately 6 million people in the US who are currently diagnosed with dementia or MCI, which is mild cognitive impairment. And that's a big diagnosis as well. I will talk more about that and what that means. Maybe today, maybe in the near future. But there's 6 million people that have been diagnosed with dementia or mild cognitive impairment. And there's about 50 million people in the world who have been diagnosed with dementia. And this is supposed to grow by 10 million new cases every year, which is extremely, extremely devastating. And if you are a person who has been diagnosed with dementia or a family member, I am sure you're very confused and quite scared. First, what is dementia? So the NIH, National Institute of Health, defined dementia as a group of social and thinking symptoms that interferes with daily functioning. And that's a really broad range definition. So basically it's not a specific disease per se, but rather a group of conditions characterized by impairment in at least 2 brain functions. So that could be memory and problem solving or judgment and insight. So the symptoms of dementia include forgetfulness, limited social skills, thinking abilities so impaired that it interferes with daily functioning. There are some medications and medication trials that are being used right now, and there are some therapies that help manage the symptoms of dementia. And I'm not going to go into what they are because I'm not a medical doctor. I don't want to give you medical advice. I want to approach cognition and dementia from a therapeutic standpoint, which is what I am, a speech pathologist. So I sometimes use cognitive impairment and dementia interchangeably. I will explain if there's a difference, but usually I'm just using them interchangeably. So cognitive impairment is a result of dementia. It's not a medical diagnosis unless you are diagnosed with the specific diagnosis of mild cognitive impairment, or MCI. Okay, either way, just understand that I sometimes will use them interchangeably. And if you have any questions about my use of terms or any terminology, please write in the comments so that I can answer some questions. And really that goes for every video. I want to see comments and questions. I want to help you solve the problems that you're currently having in your daily lives. So dementia is complicated. We usually talk about dementia by describing its severity, which is pertaining to the level of impairment and loss of cognitive function. And we can talk about dementia in stages, which is basically a prognostic indicator either of where you are or a way of describing severity. And we can talk about the specific diseases that cause dementia or the type of dementia. And we can also talk about how or if dementia is chronic or progressive or even transient and can be reversed. The latter terms also have to do with prognosis. Sorry about that. So I hope to clear some of these terms up for you. So let's talk about the types of dementia. So dementia is, for the most part, a neurological condition. It means that it affects the brain, and because the brain governs all our physical, mental, and autonomic functions, meaning breathing, if something goes wrong with the brain, these functions are going to be affected. So what exactly can go wrong with the brain? A lot of things. All of the things I mentioned can result in some type of level of dementia or cognitive deficits. Dementia can be grouped into 2 or 3 types. I am adding a third type because my experience tells me that dementia can also be chronic. So these 3 groups are the progressive kind, and that is the kind that gets worse over time. And then there is the reversible kind, and that is when somebody has a dementia as a result of some sort of metabolic problem, and I'll go into what that means too, and that is reversible. But there's also a chronic kind where you get to a level, or your loved one gets to a specific level, and they don't really get worse. They don't get better, but they don't get worse. So progressive dementias are the ones that we dread, because the ones that you see the movies and you hear about, like Alzheimer's disease is a progressive dementia. They lose their memories and function, personalities, and ultimately they wither away and die. But not all progressive dementias do end like this. Some, as I said, you could be diagnosed with a progressive dementia, but it goes to a certain point and it doesn't have to get worse. Many times it does. So the types of aggressive, progressive dementias are included, but not limited to the following. So there's Alzheimer's disease. It's the most well-known, and it, by the way, it's pronounced Alzheimer's. And it's not old-timers. It's usually aggressive and usually progressive. It's the dreaded Alzheimer's disease that we are all familiar with. There's Lewy body dementia. This is the kind of dementia that Robin Williams had, and it was very depressing for him, I can imagine. But they lose their personality. People with this dementia, it usually is very progressive. It affects your motor skills. It's kind of like the kind of dementia that you get with Parkinson's disease. But it can also stand on its own. And so it refers to the type of growths in the brain or cells in the brain that form Lewy bodies, which is sort of like a kidney-shaped body of brain tissue. And it's diagnosed by looking at the brain and seeing those kidney-shaped Lewy bodies. Alzheimer's disease, by the way, is diagnosed usually after somebody has all the other dementias have been ruled out, and it's usually only specifically diagnosed when somebody passes away and they do an autopsy, and they can see what they call aluminum plaques in the brain, or tangles. So it's a wad of messy stuff in the brain. Then there's a type of what they call progressive dementia, vascular dementia. Vascular dementias have to do with blood flow to the brain and the dying off of tissue, or the atrophying of brain tissue that happens because it's not getting the blood supply that it needs, and therefore the oxygen that it needs. And the tissue just deteriorates and dies. And this is really what I was talking about when I said that not all of these progressive dementias evolve or progress to a point where somebody completely loses all their functions. This kind of dementia can be chronic. It probably won't get better, but it may not get as worse as something like Alzheimer's and Lewy body. Then there's another type of dementia. It's frontotemporal dementia, and it's a group of diseases that are characterized by the breakdown or degeneration of nerve cells and their connections in the frontal and temporal cortexes of the brain. The areas generally are associated with personality, behavior, and language, and common symptoms will affect behavior, personality, thinking, judgment, and language, as well as movement. It sounds like everything, doesn't it? Well, it kind of is, and it is pretty progressive. I've seen this to be very, very progressive. And then there's a mixed dementia where they say, well, many of our dementia patients have a mix of different types of dementia, like Alzheimer's disease and vascular dementias, or Lewy body dementias and Parkinsonian dementias. So there are undiagnosed kinds of dementia that are considered mixed dementias. So the other diseases that somebody might have that are linked to dementia could be things like stroke and traumatic brain injury, Huntington's, chorea, and Parkinson's disease. And all of these diseases have somewhat of a cognitive impact. And there could be other connective tissue diseases that you might see some cognitive impact on, like maybe scleroderma, even Lyme disease, and other kind of connective tissue disease. Lyme disease, of course, is a virus. So there are conditions also that cause symptoms of dementia, but they are reversible. Now we're going to get into the reversible types of dementia. And these, I said, are usually reversible, which is fantastic. Metabolic dementia. So metabolic dementia is where there's an imbalance in the chemical processes of the body. And they are reversible because as soon as they're diagnosed, identified, they can be treated. The originating cause can be treated, and therefore cognition usually comes back. It might not come back perfectly, but it can be reversible. So once these imbalances are treated, it can take a little while, but cognition can come back. So a common type of metabolic dementia would be the mental changes that occur with a UTI. So you've all heard of elderly patients that they want to check if there's a UTI before they do anything else. So if somebody has a sudden change where they seem more confused or more demented, it's a really good idea to get a urinalysis, because that bacteria goes into the body, crosses the blood-brain barrier, and affects the brain, and really confuses our elderly patients. So once that UTI is taken care of, they stop being wacky, but they get really wacky with these UTIs. Also, elderly patients that have had fractures in their hips, the bloodstream gets affected by fractures. And so it can cause a metabolic dementia. And once those fractures are resolved, there could be a return to the premorbid state, which was how the brain was working prior to the fracture. The other things that can work on the metabolic changes of the body are medication. Sometimes people take medication and it just changes everything. Maybe one medication and the next day they can't think properly. Diabetes can change the brain as well, and hypothyroidism can change the brain. So those are all different ways that cognition or dementia can be reversed, or in those types of dementias can be reversed. There's also anoxia, which means low oxygen to the brain. And so that's why sleep apnea is so important to catch, because throughout the night you could be losing more and more oxygen to the brain. And once that problem is resolved, sometimes cognition can return to normal or close to normal. Sometimes the brain tissue does die off. So for those of you who've come away with being diagnosed with dementia, and they've just been diagnosed with dementia and actually understand what dementia is, that means that your doctor's doing a good job. But so many times people come away from this diagnosis bewildered, without any resources, and they have no idea what kind of dementia they have. They're just told they have dementia. So the thing that I want you to remember is to if you are diagnosed with dementia by a physician, my advice to you is to please go to a neurologist, maybe have some neuropsych testing or neurocognitive testing. If you're having specific difficulty completing certain tasks throughout your day, a speech pathologist can help you with that, or a cognitive therapist can help you with that. You might want both of those things. You might want to participate in a local chapter that helps support people with diagnoses with dementia and their families. But in any case, I really hope to help you here. And we're going to talk about those cognitive deficits, what they are, and get into each one of them in subsequent videos. But for now, I want you to give me a thumbs up and hit subscribe, because if you do that, then you will get notifications when I put out my new videos. And I'd also like you to comment in the comment section and ask me questions, because I'd really like once a month to get enough questions that I do a live video answering your questions. And I will not have all the answers, and I will not give you medical diagnoses. But what I will do is offer you some solutions to problems that I might have seen that you may be experiencing right now. So thanks so much for tuning in. I really, really appreciate it. Thank you for watching Diagnosis Dementia.